9:24 on WATD. Coming up next on the South Shore's Morning News, Dr. John Hayes and Living and Practicing by Design.
Quirk Kia South, offering the same great customer sales and service you expect from a Quirk dealership. Come in, browse their huge inventory, and drive home in a brand new Kia, like the 2025 Sorento S or the 2025 Kia Seltos LX. And the Quirk service department will be available to you for the lifetime of your vehicle. Quirk Kia South works for you. Quirk Kia, 923 Plain Street, Marshfield, just off Route 3 at the new Exit 27.
Quirk works to save you money. Quirk works for you.
Visit QuirkKiaSouth.com. 95.9 WATD, the South Shore's Morning News continues. I'm Rob Hackala, along with Beth Foster. And it's time now, as we do every week at this time, we check in with Dr. John Hayes, Living and Practicing by Design. drjohnhayesjr.com. That's drjohnhayesjr.com. Dr. Hayes, good morning.
Hey, Rob. Good morning. Good morning, Beth.
Great to see you.
Same here.
Here we are, another week, and this week's topic, zinc and viral infections.
Yes, so this is a really hugely important topic, and this is, once again, a little bit lengthy, so again, like you do, Rob, I always refer people to go to the blog, read the article, there's a lot of good information here, but a couple things. First of all, zinc is a trace element, meaning we need a relatively small amount of it, but if we miss zinc or we're deficient in zinc, we can be prone to a number of different conditions, prostate issues in men, and also in infectious suppression or fighting off infections, especially viral infections. It's so critically important that very, very early on, I want to tell this story because it's not well publicized, but I think the public needs to know. So back in 2019, before COVID was named COVID in this country, the virus was in other parts of the world. There were physicians that were successfully treating COVID with HQ, hydrochloroquine, and zinc. The reason being is that it's been proven that when you give patients HQ, among the other beneficial effects, it absolutely and more effectively seems to allow zinc to enter cells, and the combination of HQ and zinc together was being used to treat COVID. The media, of course, got a hold of the whole HQ thing. Remember the whole New York City thing, and then Governor Cuomo got involved, Trump got involved. It got so politicized, but the public never knew that one of the reasons that HQ was effective is it allows zinc to enter into cells, and hence for some people early on again, HQ was in fact a good treatment for COVID.
Okay.
It was way before it was even announced. So that's just one of the tip-offs. The other thing is there has been other studies have been done that show that giving patients zinc early on, like at the first sign of viral infection, you can shorten the duration of the viral infection by sometimes up to 5 days.
Really?
Which means, which means for some of these illnesses, you can just cut them off very quickly, within 5 days rather than 10, or something turning into bronchitis and pneumonia and going on 3 weeks. And then, the last thing I want to say is that during COVID, so in my career in medicine, when I matched to residency, COVID started. It's like, boom, I matched to residency, COVID hits, the world goes crazy, and all of a sudden we're in like La La Land, we didn't know what to do. People were dying. People were getting very sick. We had
respirators.
Exactly.
So,
but what the smartest physicians were doing very, very early on is we knew about zinc, and we also knew that vitamin C had a role and vitamin D has a role, which we've spoken about before. But what we did very, very early on is to give patients, especially the outpatient, not the sickest, but outpatient early on, vitamin C, D, and zinc together. And if we did the right doses based upon the patient's health, based upon medication history and so on, many, many, many patients got better relatively quickly and didn't need to advance to hospitalization care or inpatient ICU care.
Okay. I think it's so important that people know this, because when I found out that we were talking about zinc today, Rob, I got so excited because I take a zinc supplement nightly. And this is from, past illnesses or sicknesses that I've had. I've had COVID a couple times, unfortunately. Yeah. But I feel if I miss my zinc for one night, I feel like my immune system is a little bit compromised when I wake up. The only problem with zinc, I would take massive amounts of zinc if I could. I know.
Yeah, not right.
Again,
yes,
talked about
but if I can, the only thing is that it can cause a stomach ache.
It can.
Yeah.
It can. So again, a lot of it comes back to diet. So a wide variety diet. If you have seafood is usually a good source of zinc, but also has other things that aren't so good for us. So we're not turning to eat as much seafood as we did once upon a time. But so seafood, nuts. Are also a good source of zinc. So a wide variety in the diet. But you really only, when you look at what the recommended dietary allowances are, probably anywhere between 8 and 10 milligrams a day. When you look at average supplementation, what I recommend for most patients for daily stuff is around 15 to 30 milligrams per day. Because the issue is if you get really, really low in zinc, you're more susceptible to having an infection and you need more zinc to supplement if you get an infection. But the other issue is that in this media-driven world where people just like to self-diagnose and this phenomenal marketing of this supplement and that supplement, they go overboard. And if you take more than 50 milligrams of zinc on a regular basis, you can actually cause immune suppression.
Wow. So the opposite of what you're trying to achieve.
Exactly. So you've got to be careful. This is why one of the things that we do with patients that have recurrent infections, we can check zinc levels, we can check hair levels of zinc and so on. But just really important to know that, very, very early on in a viral illness, assuming there's no medical contraindications, check with your own physician. But I very commonly advise patients to use what I did in COVID, and that is combination of CD and zinc very, very early on.
CD and zinc.
Yes, and I tell people the biggest thing with this, just like when COVID was in other countries, it was early. They were nipping it in the bud. You don't wait until you can't breathe. You don't wait until you're short of breath. You jump on these symptoms early. I say, look, the first sign of fatigue, runny nose, your eyes are watery. Is it allergies? Could be a virus. Well, it's not going to hurt most people to take a little extra CD and zinc early on because you can shorten the duration of these illnesses in many cases.
Yes. So why not? You're right. If it's something that's not going to hurt you, this could be, in fact, something that is important to do early.
Exactly. But again, you've got to be careful. You should have a physician that knows you, knows your medications. And people respond to supplements in dramatically different ways, like stomach upset, very common with a lot of the over-the-counter supplements. Sometimes zinc given in a powder, which is what we use, is better than a tablet early on, too.
Okay. Yeah, because I remember, my mom would always say, as soon as you're getting sick, she would say, I think there was like a lozenge that had
zinc lozenges.
And
she'd say, "Yep,
are you taking your zinc?"
Yeah,
she would call and tell me.
Spray and so on.
Yeah.
And I said, I said, I don't know if I need that, but maybe I do.
No, the lozenges have actually proven to be very good.
I've used them. I like them. They do stop the cold after a little bit. They don't let the cold manifest longer.
Okay. But the key is, sorry to cut you off.
No.
But I think the key is, so we know it has extreme value, but what I tell people is, look, keep it handy. Just be smart. I mean, this is the time of year to be planning. So these are things you should have in your bag. I keep some in my backpack just in case I'm traveling or something. I don't have it with me. It makes
I always agree
because
the last thing, I don't know if it happens to you guys, probably not you, Doctor, because you're very prepared, is when you're just not feeling well and you have nothing, and then you're just like, I don't feel like going to CBS.
No,
I wish there was a robot that could get it for me.
Well, yeah,
or DoorDash, but basically, this time.
But you're right. It's better to, if you had it, you would end up just taking it right away.
Be prepared. Just be prepared. It just goes a long way. And if you need help, ask your personal physician.
I have so many supplements at home, so I got to get Rob on my train.
Well, I'm learning this. I feel.
So consolidation is helpful.
It's important to figure out what to need because it seems like obviously with the times that we're in now or whatever, maybe we're not getting as much of something that we can become deficient in a lot of things.
Right.
And I wish sometimes it'd be nice if there was some magical indicator that we had. Maybe someday there'll be I can scan with a tricorder doctor or something. I can see my levels are down.
Well, that would be really cool. We're getting closer to that stuff all the time.
I mean, you think about like a car, if you're low on oil or fluid, because otherwise you have to guess a little bit. I assume that nature probably designed it if we had a proper diet, it would take care of itself naturally.
So our check engine light is we have a runny nose or we just feel like
a little bit icky.
Oh, man. So what's going on?
I take supplements at the first sign of ick. And so wait, I just want to clarify, going into the winter months where we might feel a little bit more vulnerable to illnesses, if we're already taking, for instance, like myself, if I'm already taking a daily zinc tablet, should I up my levels during the winter? Should I not be taking it daily?
Not necessarily in the winter. And again, a lot of it depends upon your individuality, how you tolerate, what your absorption is like, and so on. But I think the most important thing to realize is that, okay, so I'm a firm believer in daily supplementation, relatively low amounts, because a lot of the over-the-counter supplements and a lot of professional supplements in many cases are even worse. The amounts that people take on a daily basis for a lot of things are not necessary. But having some fuel in the tank, so to speak, but then having that extra to go to when you need it is just a game changer. And
yeah, because I think with a lot of us too, it's just natural to think that if Beth takes a zinc pill every night and she's feeling good, I'm going to take 5, and that'll make me feel even better.
Right, and that's the caution.
We make people think that sometimes more is better.
Yep.
In many cases, it isn't.
In many cases, it's
you're
not.
like, well, the pill seems very small.
Right. Yeah, exactly. So
it can backfire.
It can backfire.
So now, I guess to leave people, then should we be taking a zinc supplement every day? What do we talk to our doctor first?
Talk to your physician.
Okay.
Talk to your physician.
Right. That's step one.
And so this is the thing. Your physician should have basic laboratory studies done. If there's any sign, if you have like recurrent infections, that type of thing, we can check zinc levels. We can do, like I said, hair analysis sometimes can be very valuable if it's done properly for storage of metals and so on. There are some other testing to be done as well. But just being smart about having simple things available, like vitamin C, we've known forever, helps with viral illnesses. And zinc, there's a significant amount of evidence that zinc can actually reduce viral replication, which is huge. It can actually help the pro-inflammatory cytokines, which are the substances that help balance out the immune system and suppress inflammation. So you're talking about a gigantic role for something so simple and inexpensive. Zinc lozenges or whatever supplement your doctor recommends.
His mom was right about those lozenges.
No, yes.
Yeah, exactly. Yep.
It's true. It is like the least expensive
it is.
preventative thing.
Yep, it is. Yeah, zinc lozenges.
Yeah, well, I mean, she is a nurse and she works at a hospital, and I do.
There you go.
I should probably listen to her often. But but I noticed, some of the times getting through the winter, she said she's had very good results with that.
Exactly. Yeah. I mean, adequate hydration. Common sense with regard to being around people that have infections and that type of thing. Obviously, goes a long way. And then just being prepared. So, I tell patients, and this is not medical advice, but I drink this time of year. Mucinex, the real Mucinex, not generic. That's another whole conversation. Not generic. Nasal saline spray, sterile nasal saline spray. Hopefully something manufactured in a country that has responsible ethics, because that's been an issue too. So Mucinex, nasal saline spray, and zinc of some type.
All right. Well, you can read, as we said, we're just giving you a general overview here. Go read the full blog. Dr. John Hayes has it up on his website, Zinc and Viral Infections. That was posted earlier this week, and you can go to drjohnhayesjr.com, drjohnhayesjr.com. You can also call or text his office, 781-659-7989. 781-659-7989. Dr. John Hayes is with us every Thursday at this time on WATD. Thank you, Doctor.
Thanks, Rob. Thanks, Beth.
Thank you.